During times of transitions of care, whether that is a transition from an inpatient hospital stay to the home environment, or it may be from a home environment to a long-term care setting, or the reverse of any of those types of transition of care are definitely times when adverse drug events may happen. We frequently see situations where a patient was admitted to the hospital for whatever reason. Frequently it may be related to an exacerbation of a chronic disease state, something like chronic heart failure as an example. And they had a given list of medications that they were taking at home, and then they are admitted to the hospital, and maybe those medications need to be modified to help to better manage that disease state. And now those are situations where the patient has one pile of medications at home, they've just been sent home with another pile of medications, and they're provided some discharge counseling at the point of going home, but frequently that's the time when patients, all they're focused in on is going home. It's really hard to be able to listen to potentially complex instructions, and so they get home and they're not sure what to do. So those are certainly times, once they get there, they may say, oh, I'm afraid, I don't know what to take, so I'm not going to take anything, or I've got all of these and perhaps I'm supposed to take all of them, or anywhere in between. So that's certainly, I think there are several key points within that transition of care where a pharmacist's involvement is critical, and these are areas where we're continuing to evolve models of care to address some of those situations. For example, at the point of coming into the hospital in the emergency room or up on the floor on the inpatient unit, those are key points when the pharmacist and pharmacy team frequently will be interacting with the patient, their family, perhaps their community pharmacy as well, to be able to identify what are the medications that you have been taking at home. So as they're coming into the hospital, to make sure we know what those medications are at that point, and then continuously reconciling those medications throughout the hospitalization and at the point of discharge. But then I think, again, as they are transitioning to their new care environment at home, long-term care, wherever that might be, that's another key point where a pharmacist should be involved. Either it may be in a follow-up phone call, it may be in a home visit, it may be in a clinic face-to-face visit, to help to optimize and ensure that patients are taking the correct medication.